I would like to recognize Dr. Patterson, our district's medical officer for over 30 years. In that capacity, she guides health policy and protocols and is a resource to district nursing staff. Dr. Patterson has served on countless state, community, and district task forces in the service of meeting student health needs. Dr. Pat also serves as the Assistant Director of the Pediatric Clerkship of the Barbara Bush Hospital. Pat has served as a pediatrician at Maine Medical Center Pediatric Clinic since 1988. She is an attending physician at Maine Med's Pediatric Clinic and works weekly in our school-based health clinics. In that capacity, she has provided firsthand medical care for thousands of Portland Public Schools children and their families. In the 1990s, Dr. Pat was an advocate for the first student with HIV to attend Portland Public Schools. At the time, HIV was poorly understood, and that student's attendance was met with a great deal of fear and resistance. Dr. Pat's steady leadership made it possible for that child to attend school as part of a full and healthy life. In 1995, Dr. Patterson was instrumental in getting school-based health clinics in our high schools and at King Middle School. These clinics are a vital healthcare resource for Portland teens. Over the years, our school-based health clinics have expanded available health resources to students, including dental care. Dr. Patterson has played a key role in welcoming our newcomers and bridging them to appropriate healthcare services. She has helped us, the district, to craft protocols that are models for other school districts. Before COVID, there was H1N1. That was a frightening pandemic because H1N1 was particularly dangerous to school-aged children. Dr. Patterson led the district and nursing staff in developing response protocols and the first school-based vaccination clinics. At the time, schools were the only place that vaccines were available to children, and those flu clinics are now a yearly occurrence, greatly reducing the amount of time students need to be away from school. Her leadership this past year has been essential to our in-person learning. She serves on the Maine State School Health Advisory Council, and she's worked tirelessly with our amazing school nurses and regularly provided science-based guidance that has allowed us to continue safe in-person learning. From day one of the pandemic, Dr. Pat has only been a phone call away when we needed to think through what to do in response to guidance or new developments. She has always been a calm, thoughtful, and knowledgeable partner during this public health crisis, whether deciding whether we should close, evaluating how we should go about reopening schools, or supporting the implementation of specific protocols for pool testing, N95 masks, vaccination clinics, or any of the other new experiences of this past year. Dr. Pat has been a source of science-based, compassionate, and patient leadership. We will miss that leadership as we move forward, and I cannot thank you, Dr. Pat, enough for the many years of service to the students, families, and staff of the Portland Public Schools, and never more so than in this particular year. Our nurse coordinator, Tina Valiu, is here to say some words on her behalf and on behalf of our school nurses. Tina?
Yes, thank you. I'm very happy and honored to talk about Dr. Patterson tonight and echo everything the superintendent just said. I thank her for her incredible dedication to the families of Portland. And for myself and on the behalf of the nurses, I thank you for your steady and knowledgeable leadership. When I first met Dr. Patterson was at a district health advisory committee, and she was advocating for full and inclusive health education for Portland students. A few years after that, I saw you stand up, Pat, to an incredible amount of adversity when you were advocating for expanded health care at King Middle School to provide health care needed to those students. You are courageous and you are calm. For nurses, she's approachable. She's been a wonderful teacher and a resource to us. She's an advocate for school nurses. and promotes the importance of the school health connection with her residents. She's a teacher at the hospital also. As a superintendent said, we could not have gotten through this past year without you, Dr. Patterson. We began planning for COVID almost 2 years ago. You provided an incredible amount of background work, research, and connection to health resources for the schools. I personally am deeply grateful, not just for this year, but for your incredible career. It may not be obvious to most people, but you have been a critical component in making Portland schools a welcoming and inclusive place. Long before we created the Multilingual Center, long before we talked about equity, or we had the courage to march on Pride Day, or we knew what trauma-informed practice was, you were doing it. You were doing the real work of it, the real everyday work of it, one child at a time, one family at a time. You were working to include all people, to improve the quality of their lives and affect change for families in Portland. And you were teaching others to do it too. For that, Portland Schools is a better school system, and Portland is a better place to live and work. We haven't mentioned that through her long career, Dr. Pat also raised 3 sons, and we know in her next chapter, she is looking forward to more time with her family and her grandson. We wish you well. I want you to know you have left an indelible mark on this community. Your work is now our work, and we are proud and grateful to carry it forward. So thank you, Dr. Patterson.
When I discussed succession plans with Dr. Pat and with Tina, we quickly coalesced around Dr. Geeta Rao, who's with us tonight. Dr. Geeta has been leading the school-based health clinics for a number of years through her work at Greater Portland Health, and she's worked very closely with Dr. Pat. As a result, she has a strong understanding of our district's worth on many health-related fronts, and I'm thrilled that she will continue this tradition of medical leadership for years to come. And Dr. Geeta also wanted to be here to recognize and honor Pat. So, Dr. Geeta.
Great, thank you. It's a pleasure. So Dr. Pat has just been an amazing teacher and educator to so many of us in the community. And so it's a pleasure to have this opportunity to say a thank you more formally. Like's been mentioned, she's served thousands of families in the district. I've seen her keep her door open in school-based health to so many students and have heard her on the phone with families to explain visits afterwards with compassion and care, helping families navigate even the most challenging things in our healthcare system around medication access and information, just confusing information. And she does it just with such grace and has truly been an inspiration to the other providers in the school-based health center. She is, an advocate in so many ways for student health and has led us in the local levels and state levels in terms of advocating for school-based health center resources. Her testimony has been moving in legislation. And, I think for me personally, I remember joining school-based health and being at early meetings and looking to her for guidance. And she has this gentle, soft nod when you're speaking that really means that you're saying something of value that I found in the last few years as we've been working so closely together in school-based health, that as I'm proposing an idea or trying to offer some idea for change, that looking over her and watching that nod just means so much, because she is just so respected in the community and her contributions have been so tremendous. So I appreciate her cell phone so many times this year and in years past, and appreciate the wisdom and want to make sure you know how much the school-based health centers have appreciated you, well before my time and in the last few years, and how much you've given to so many of us in learning school health.
Thank you, Dr. Geeta.
I see Ms. Thompson has her hand up. Ms. Thompson, please go ahead.
I promise I won't speak on every one of them, but I wanted to just talk to you, Dr. Patton, and say thank you so much. I think that Tina has also touched upon it, as well as Dr. Geeta, is how highly respected you are in this community. And I want to personally thank you. I was a board member when you got us through, along with my past friend, Amanda, the contraceptive conversation at King Middle School, which became a national event, and you were steadfast. And I know I personally, being a board member at that time, turned to you, and I know Amanda turned to you, and you really got us through a very, very tough time. So that I'm grateful for, as well as all your advocacy over the years for our school-based health centers. And also, as the superintendent alluded to, I first got to know you a little bit when we had the first student with AIDS in the state of Maine through our schools. And you and Amanda, I know, worked very closely together to make sure that she felt welcomed and that everybody was put at ease. So thank you. I hope I run into you at the hospital. I didn't know if you knew I was there, but hopefully I'll run into you at some point. But I want to thank you from the bottom of my heart for everything that you've done. So thank you.
And Dr. Pat, just as with Mr. Moses, we have a little token of our appreciation, beautiful remembrance of the Portland Public Schools.
Thank you so much. If I could just say a couple words. I draw my strength from each and every one of you to be able to work in such a community that is so dedicated to improving the education and health and well-being of the families within it. It's been my energy source, because I see all of you working so hard and tirelessly for the same goals. And I'm more on the health, you may be more on the education, but the center is the same. It's the students and families in the Portland district. And it just fueled me over the years. And I've been incredibly grateful and very, very fortunate to have worked with so many dedicated people over the decades. And I am thankful to all of you.
Thank you again, Dr. Pat. Thank you for your leadership, and we will definitely miss your guidance and look forward to seeing you in the community.
Thank you.